As America's coronavirus death toll neared 90,000, Donald Trump was retweeting a video depicting him in the role of fictional President Thomas J. Whitmore in the 1996 film Independence Day.
And should we win the day, the 4th of July will no longer be known as an American holiday, but as the day when the world declared in one voice, we will not go quietly into the night.
The video clip, which features some of his key allies, was compiled by one of his Twitter fans, the Mad Liberals. It peddles the president's narrative to restart America's economy as he attempts to shift focus away from the health crisis gripping his nation. His predecessor has also become a key target.
This was all Obama. This was all Biden. These people were corrupt. The whole thing was corrupt, and we caught them.
In a pre-recorded interview with Fox News, Donald Trump continued to peddle his newfound theory Barack Obama was out to undermine his presidency.
Do you believe President Obama directed the U.S. intelligence agencies to spy on you?
Yes, he probably directed them, but if he didn't direct them, he knew everything.
In recent days, he's launched hundreds of attacks against the former president on Twitter, on television, at official press conferences and even on the White House social media page. Most of them about his new catchphrase, Obamagate, a baseless claim the Russia investigation was a political hit job ordered by Barack Obama.
With Mueller, that whole thing turned out to be a total fraud. The whole Mueller investigation's a fraud. What they did to these people is a international disgrace.
Donald Trump's barrage started after a leaked web call in which the former president called the White House response to the pandemic an absolute chaotic disaster. Barack Obama weighed in again yesterday in a video message to graduating students.
Doing what feels good, what's convenient, what's easy, that's how little kids think. Unfortunately, a lot of so-called grown-ups, including some with fancy titles and important jobs, still think that way, which is why things are so screwed up.
It's the first time Barack Obama has spoken publicly since the pandemic began. It might not be his last.
Catherine Diss reporting there for the ABC. For weeks now, Australia has been risking the fury of China by calling for an independent investigation into the pandemic and its origins. The Prime Minister, Scott Morrison, is confident he'll have the backing of the UN's World Health Assembly, which is being held later today. The ABC's Stephen Jedgetts reports.
It's a curious coalition of middle powers. When Australia first called for an independent inquiry into the coronavirus outbreak, it looked very alone and was publicly denounced by China. But now 62 nations, including Japan, South Korea, Turkey, India, Indonesia, Russia, Brazil, South Africa and the European Union, have endorsed a draft motion calling for a probe of the international response to COVID-19.
The coalition is diverse and it's somewhat eclectic and creative, but it's a coalition that matters.
The head of the ANU's National Security College, Professor Rory Metcalfe, believes the willingness of so many countries to back the inquiry vindicates the federal government's push for transparency.
Australia got off to a somewhat ragged diplomatic start in its push for this inquiry, but it refined and evolved pretty rapidly. And importantly, I think the principles behind Australia's position have been absolutely borne out.
The draft motion is a carefully crafted compromise. It does not specifically mention China or the wet markets, which are believed to have spawned the virus. But it does call for the World Health Organization to undertake an impartial, independent and comprehensive evaluation of the international health response to COVID-19.
Stephen Jedgetts in Canberra. To the UK now, where the government insists its reopening of schools will be guided by the best possible scientific advice. The government plans to begin a phased reopening of primary schools in England from next month. But what exactly does the science say about children and the coronavirus? The BBC's Dominic Hughes went in search for an answer.
The arguments over when or even whether schools in England should reopen before the summer come down to the safety of staff and pupils, how the virus behaves in children, and the extent to which they could pass it on to adults. So, what does the science tell us?
We do know that children do become infected, And we measured the amount of virus in their nasal samples, and that looks pretty similar to adults. What we don't know is whether these children then are able to pass on to other adults or to other children.
Is that where the argument lies, do you think?
Definitely. So we need to see evidence that the children pass on to other people. And we can do that through our contact tracing type approaches, where we can follow the chain of infection and see whether children are part of that.
The other important question is, what is the risk posed to adults, both the teachers the children will see at school and the ones they live with at home? Well, children seem to be as likely as adults to get infected, and yet they seem to also suffer fewer symptoms for a shorter period of time and seem to infect fewer people as a result. But the truth is, it's early days and we simply don't know for sure. Scientists say they need much more data.
The BBC's Dominic Hughes there. And staying in the UK, we are all desperate for positive news about a vaccine for COVID-19. But scientists around the world are warning that development could take years rather than months. Well, not so at Oxford University, where the research team there says its vaccine could be ready by September. CNN's Max Foster has more.
It's hugely ambitious to think that they can have this drug out and with people that need it by September. What the government is saying, though, is that they're going to give another $100 million towards both of these projects to try to accelerate them. And they're also working with the drug company AstraZeneca to try to come up with a production system. And they believe that with AstraZeneca, they can produce 30 million doses of this vaccine in September. And that'll be for the UK, and then 100 million for the wider world. But it does depend on developing a vaccine, and they're not there yet. So it's ambitious, and a lot of people are questioning really this timeline. But nevertheless, the government's throwing everything at this particular project, particularly the one up in Oxford.
CNN's Max Foster there. Homophobia and transphobia in Poland has increased now to the point where almost a third of the country has openly declared that it is LGBT-free. This report from Deutsche Welle investigates what's behind these official resolutions in municipalities like the town of Stum.
Since February, gays, lesbians, bisexuals and trans people have been finding life even more threatening than usual. Jacek Jaszczurnik has spent years fighting for LGBT rights.
The climate has changed. Things have gotten worse. It affects people's attitude towards LGBT people. But what's worse is the constant accusations against us, allegations that we have bad intentions. We are out to deliberately destroy families and sexualize children. When the authorities, the church and the government make all these claims day in, day out, it has an effect.
Poland is struggling to accommodate its own LGBT people. Here in Stum, they've passed a resolution in favor of the traditional family and implicitly against gays and lesbians. Zbigniew Poncewicz of the conservative governing party PIS, or Law and Justice, is one of those in favor of the resolution.
We are protecting our 1,000-year-old traditions here. A relationship that promises a future is a relationship between a man and woman. If other relationships were natural, humanity would die out.
Critics say this provokes hate against minorities. Right-wing hooligans feel justified in launching attacks on queer people. The ruling PIS party sees the LGBT community as the problem, not the gangs who take the law into their own hands.
That report on the rise of homophobia and transphobia in Poland from the broadcaster Deutsche Welle. And finally, India has extended its nationwide lockdown until the end of May to try to curb the spread of the coronavirus. The lockdown was due to end today, but the number of positive cases has now steadily climbed above 90,000. And that's World Watch Today. I'm Max Toll. Back to you, Money.
Thanks, Max. And that's Midday Report, Te Purongo o Te Pautūtanga for today, Monday, May the 18th. Stay tuned to RNZ for the daily COVID-19 briefing shortly after 1, today with the Director General of Health, Ashley Broomfield, and the Commissioner of Police, Andrew Costa. We'll be back tomorrow with interviews and the latest news from Aotearoa and the world. But for now, from the Midday team, kia pai tō rā, hea pōpō, and we're coming up to the news at 1 now with Paul Brennan.
RNZ News at 1. Good afternoon. I'm Paul Brennan. The New Zealand population has eclipsed 5 million people, fast-tracked by unusual migration patterns amid the COVID-19 pandemic. Figures released by Stats NZ today show the population provisionally reached the 5 million mark in March. It's the fastest million in history, taking just 17 years to grow from a population of 4 million people in 2003. Senior demographer Kim Dunstan says while it was expected the country would reach the 5 million milestone this year, travel restrictions due to the global pandemic have sped things up. He says many New Zealand citizens have returned home after living overseas. Air New Zealand says it will now offer refunds to customers who were set to transit through the United States on cancelled Auckland to London flights. Consumer New Zealand has complained to the Commerce Commission about Air New Zealand's refund policy, saying it's misleading customers.
Kia ora koutou katoa. Welcome to this afternoon's briefing. I've got Police Commissioner Andrew Costa with me here today. I'd like to start off by talking a bit about our cases for the day, the World Health Assembly that is convening tonight in Geneva virtually, and also a comment around religious and faith-based gatherings. First of all, I can report there are no new cases of COVID-19 to report in New Zealand today. So our total number of confirmed and probable cases remains at 1,499, and of these, 1,149 are confirmed cases, the number we report to the WHO. No change in the number of people who have recovered from yesterday. That is 1,433, which represents 96% of all confirmed and probable cases. There are just 2 people in hospital again today, one in Middlemore and one in Auckland Hospital, and neither are in intensive care units. The number of significant clusters remains at 16, but obviously no additional cases to add to any of those. And there are no additional deaths to report today. Yesterday there were 2,570 laboratory tests processed, and so our total number to date is 230,718 tests. Tonight, I'll be leading the New Zealand delegation at the 2020 World Health Assembly. This is held annually in Geneva, usually over a period of a week. This year, because of the circumstances, it will be undertaken virtually and over sessions over a couple of days. I'm looking forward to hearing from the WHO Director General, Dr. Tedros, on his thoughts for the future efforts around COVID-19 globally, and also about broader global health issues. The Minister of Health, the Honourable Dr. David Clark, will be presenting New Zealand's country statement via video. I don't have a speaking part, even though I'm the head of the delegation, because the interventions by countries will be made very short. However, if there's something that member states speak about that I think it's in New Zealand's interest to intervene on, I will do so. New Zealand is co-sponsoring a resolution on COVID-19. The purpose of the resolution is to agree at a high level the future areas of work to be undertaken on COVID-19 by member states and by the World Health Organization and other organizations. And one example is, for example, to ensure fair access to vaccines as part of the global efforts to develop and make these available. At a time of global crisis around a public health issue, it's critical that countries come together, and the COVID-19 resolution aims to support that. Such solidarity will ensure we respond collectively, as we must do, to these sorts of global challenges. There will also be in the resolution a reference to a review of the pandemic and the response to it. I will note that after any global health emergency or issue, this is done. For example, it has happened with Ebola, and it happened after the swine flu pandemic, H1N1, in 2009. The findings of the reviews help inform both the WHO's subsequent work and the work of member states as well, and ensures that appropriate technical guidance and support is developed. There is general agreement amongst WHO members on the issues outlined in the resolution. There's been a lot of work been undertaken by diplomats over the last few weeks to get to that level of agreement, and it is expected to be adopted unanimously. And finally, I want to talk briefly on church and faith faith-based gatherings. I know there was some publicity over the last weekend about these. It's important I start by saying there has been fantastic support from churches and other faith-based organisations right through levels 4 and 3 and into alert level 2 across the country, and they've been very supportive and collective in their efforts to protect all New Zealanders. I know that many people, including those of faith, want to move as quickly as possible to increase the size of gatherings. I know how important it is for people to be able to practice their faith together. The policy intent for gatherings is clear in the Alert Level 2 framework, and this includes the current maximum number of people who can gather is currently 10, and this applies to both private and public gatherings, including church and faith-based ones. But this number is one of the very specific issues that is being reconsidered by Cabinet next Monday. Thank you, and I'll hand over to the Commissioner.
Thank you. Kia ora koutou. I want to open by acknowledging the fantastic effort and commitment from New Zealanders as we've moved into Alert Level 2. Apart from an expected period of adjustment, New Zealanders have demonstrated that they understand what is expected of them. Overall, in Alert Level 2, the number of breaches are significantly less than Alert Level 3. We're only getting 200 to 350 reports per day, as compared to the 700 to 1,000 we experienced during Alert Level 3. Since Level 2, we've had 983 breaches reported to police, mostly through the 10.5 phone line. About 700 of those were for businesses and 250 related to mass gatherings. A number of the complaints received have related to retail businesses not having contact tracing systems, and it's important to note that contact tracing for customers for retail businesses is not a requirement, although they must contact trace for workers. A large number of reported breaches around retail premises have related to not maintaining correct distancing measures, something which we believe is now settling down. Parties at private premises featured on Friday and Saturday nights, although not at the levels we've seen in prior weekends. And we continue to take an enforcement approach led by education, encouragement and engagement. We have recorded a total of 30 breaches. 29 of those resulted in warnings and 1 prosecution. There has been some commentary about powers of entry available to police, and since we started in Alert Level 2, there has been no entry of premises using those warrantless powers. The powers are narrowed from what has been in place under the previous state of emergency and health orders, and we in our own operational guidelines have required frontline staff to consult with the District Command Centre or our National Command Centre prior to executing a warrantless power of entry. There's an obligation to report to me as the Commissioner as soon as possible, outlining the circumstances, and in relation to Marae, the Marae Committee would also receive such a report. It's important to emphasise it is unlikely those powers need to be used with any frequency. Thank you very much.
Are there any questions?
Commissioner, can we just start off by asking you, why do you even need those powers in place if, as you say, you haven't used them so far?
The public would expect us to be able to take enforcement action in extreme cases. So the sort of scenario you might imagine is a party out of control. If we were denied access to the property by the occupants, then a power of entry would allow us to go and sort that situation out. It's not uncommon for us to have powers of entry. There are equivalent powers relating to noise control events where, on occasion, if required, we can force entry.
But as you say, wouldn't you be able to do that in normal circumstances anyway? Why do you need these overarching new powers, and don't they just alarm the public?
We can only use a power where one exists. Powers do exist for other things like serious offending, drug offending, and also noise control, as I've noted, but we can't generally enter a property if the occupants have denied entry, so the powers allow us to sort out the outlier events.
In The search warrants that you'd get in a normal situation, do they just take too long? Is that why you need this special power?
A search warrant is an option that we can use, but again, it comes from legislation. And I can't speak for Parliament, but it stands to reason that a 1 to 2 hour delay for police to sort out a mass gathering would probably be unacceptable and likely increase the health risk of that gathering continuing.
So have you got an explanation for Clearview, how police were using Clearview AI, seemingly without your knowledge?
It's been well traversed. The trial concluded prior to my commencing in the role. It's accepted that we ought to have consulted with the Privacy Commissioner before we did it. But the trial was a very narrow exercise. We determined that it was not useful in New Zealand circumstances, and we don't envisage using the technology.
Is it decided off?
I can't speak to that.
Quoted by, well, John Edwards told us that in a conversation you'd had with him that you'd said that you were concerned that it hadn't been had that sign off at top level. Can you give us a bit more detail about, you know, the concerns that you had about how this was run, even not under your watch?
Yeah. So with technology of this nature, clearly there is a public interest in its use, and privacy concerns could arise depending on how it's being used. So the normal approach we would take would be a conversation with the Office of the Privacy Commissioner to talk about the boundaries of a trial, and then we would stick within those boundaries. Now, it was a very narrow trial, and the staff involved were incredibly well intended, but we missed that crucial consultation.
So, to run hundreds of searches. So, I mean, how acceptable is that? To be running that kind of thing without official sign-off, as well-intentioned as it is?
The vast majority of searches were actually on police, volunteer police staff. There were roughly 30 searches involving a small number of cases to test the technology. It shouldn't have occurred without that sign-off. However, I'm satisfied that no one intended to cause a problem here.
A review, though, of how that was allowed to happen, given the potentially very serious nature of running such a thing without sign-off.
So, I've commissioned a stock take of any surveillance-type technologies that we may be using or trialling to make sure that there's nothing equivalent. Clearly, technology is moving really quickly, and it has good and appropriate application in law enforcement. The trick is for us to make sure that we are doing that within the bounds of Privacy Act.
Do you perceive this as a purely operational matter, one where you don't need to consult your minister, but only the Privacy Commissioner? Or in future, would you seek to consult the minister as well?
There is operational independence for police, but clearly there's a public interest where we're using technology of this nature that we consult it. So whether or not I'm required to consult the minister is something I would do as a matter of good practice.
Are you concerned that police officials specifically trialed the technology on people who they thought looked to be of Maori or Polynesian ethnicity, as well as Irish roof contractors?
I don't understand there being any particular frame that was brought in terms of who was used other than current cases of interest.
Dr.
Bloomfield, the guidelines were changed for funerals last week, and now the review on religious gatherings is not going to happen for another week. What exactly is it about religious gatherings that concerns you as a health professional? Why more than 10 people can't be in a church that might seat 200?
So when the original Alert Level 2 guidance was put out, every gathering was benchmarked actually at the number that there was for funerals and tangihanga under Alert Level 3, that was the 10. And the main rationale for that was it was felt that those gatherings where there was likely to be mixing and mingling, on top of the already quite extensive changes as we moved to Alert Level 2, just the cumulative risk was too high. And one way we could manage that would be to start with a small number, not discriminating, but for all public and private gatherings, and then to increase that over subsequent weeks. The exception was made after discussions last week around funeral and tangihanga because of those special circumstances. And the review of the number by Cabinet next week and their consideration of that and other matters as to how things are going under Alert Level 3 is again not specific to religious and faith-based gatherings, but is the number that would be allowed in any gathering, both public and private.
So what you're saying is you don't agree with there to be the need for an exemption for religious gatherings, and that next week is a broad assessment of all numbers for everything.
That's correct, and one of the key reasons we've made that exception for funerals and tangihanga is because they are unique single events, and the timing of those cannot really be changed. And I just want to go back to my earlier comments. Right through Alert Level 4 and 3 and into 2, churches, other faith-based organisations have been very supportive and done a huge amount of work to ensure that they can keep their parishioners, their staff and the rest of New Zealand safe by adapting how they create worship options or gathering options for their constituencies. And we're getting closer, and I think we all would like to see the number of who can gather increase, and that's the intention. And the number today reinforces the fact that we are on the right pathway.
Continue to get those lower numbers, do you think it will increasingly be a harder argument to have to keep those restrictions in place?
Well, my sense is that New Zealanders want to make sure we capture the gains that we made through Alert Levels 4 and 3. And we're not talking about months until we're reconsidering the numbers. It's been considered again in a week's time. And I think people understand why we need to continue to take a cautious approach and make sure that even as we get into Alert Level 2, particularly 2 weeks in, so that 14-day period, we're still confident there are not these pockets of infection out there that are not undetected, and especially with more people gathering and interacting through different environments, work, retail, other organisations, and of course in the school environment.
What role did the lockdown play in getting us down to 0 new cases today?
The Alert Level 4 lockdown? Well, it set the scene for us to be able to break that chain of transmission. We were on a very different trajectory of exponential growth, which we saw happening in other countries. And it was quite clear that if we didn't intervene quite significantly, that would be the path we would be on. We chose to act, and we've not only acted, but we've acted successfully through our lockdown, not only to break the chain, but to mean we can come out and start to ease those restrictions sooner than many other countries that have had those much wider outbreaks.
There's still quite a lot of confusion around the necessity to contact trace, particularly in retail, with a lot of shops still collecting names and addresses and emails and whatnot, but they don't need to be, do they?
Not in retail settings where where people's presence on the in the premises is short, and where there is good attention being paid to physical distancing and so on. Reducing the risk of people interacting and potentially transmitting. It's in hospitality settings where people are coming for a period of time that it is important that the names and contact details are recorded to enable contact tracing should that be required.
With the resolution that New Zealand will support tonight, I note your point that it's usual after an outbreak, but obviously this is unusual. Is there the potential that it would lead to a specific investigation about China, Wuhan, and any interaction with the World Health Organization during those early stages?
The intention of the resolution and of countries negotiating that resolution is to ensure that the right sort of review is undertaken about the pandemic from its inception through to where we are now, including the actions of the WHO, but also of member states and how they've responded. And the key outcome that is being looked for here is what can we learn, because we're only really at the end of the beginning in this outbreak, and there's still a lot we need to do. So I think it's good, and you'll have seen in our response over the last few months, we've already reviewed a number of aspects of that response so that we could learn rapidly. So I think it's appropriate, and I'm very supportive of this review being undertaken.
This resolution is like the early staging could trigger a further, more specific investigation? Or is this setting the scene for the whole kind of review?
Yes, I wouldn't characterise it as an investigation. It's a review, and it's being agreed by the governing body, which is all member states of WHO. So, as you can imagine, there's been a lot of negotiation about what the scope and nature of such a review will be, but the intent is very clear and shared by member states, that it is to find out what we can learn to inform what we do next.
New Zealand, or you as New Zealand's representative, expect full cooperation from countries like China, if that's what the resolution or the member states demand or want?
Oh, absolutely. And by agreeing the resolution, member states are signalling their intent to cooperate, including New Zealand, with any work that is done as part of the review.
On hospitality, over the first weekend of level 2, was there a significant amount of complaints for hospitality operators, or were they mostly, I guess, well behaved?
Sorry, which operators?
Hospitality operators.
Hospitality was generally very good. We've been obviously patrolling as we do in hospitality areas, and what we saw was really good compliance. People were onto it, and it wasn't an overly busy weekend in terms of that.
Commissioner, why has Marist College been allowed to open, considering it is an active cluster?
Whilst the cluster is still characterised as active, one of the things we did last week was invite members of the Marist community, including students, teachers and family members, to come and be tested as part of helping provide a degree of assurance about reopening this week. And actually the testing results were highly reassuring in that regard. Whilst there was one, possibly two, that were positive, it was quite clear that the infections had happened some weeks previously, and the view was that there was no ongoing infection within that community. So I think it's reassuring for members of that college, but also of other institutions, that actually that cluster has been well contained now, and there's no ongoing risk of further infection.
Is Taiwan playing any role today in the World Health Assembly that you're participating in?
Well, Taiwan, as a jurisdiction, is neither a member nor an observer at the World Health Assembly. You'll be aware that there has been quite a lot of discussion about the readmittance of Taiwan as a potential observer at the World Health Assembly, and that discussion is ongoing, so no agreement has been reached by member states on that.
What do you make of all the politicisation of this pandemic? You know, you've got China and verbal wars with lots of countries over this. What's your take on it all?
Well, my take is that the vast majority of countries are not politicising the response, but are working collectively and collaboratively, both as part of the WHO membership, but also in interacting with each other. And we continue to have a whole range of interactions directly with individual countries and collectively with our science advisors and through a range of mechanisms. I think most countries, if not all, recognise that cooperation will be fundamental to us being able to get on top of this pandemic globally. It's imperative that all countries are involved in that.
Dr. Bloomfield, you mentioned the 14-day sort of incubation period. Does that mean that you're concerned we could see a spike at the end of this week or at the beginning of next week?
I'm not concerned, but I'm watchful. Now over really 2.5, nearly 3 weeks post we started Alert Level 3, we haven't seen any spike in cases. We haven't found cases that were unexpected. But obviously we want to remain watchful. We want to keep up that testing across the country to make sure that if there are any cases there that may have gone undetected to date, we're finding them. And we're more likely to find them or see a spike because people are interacting more. So hence continuing the wide testing and being ready to act very quickly.
The part of the criteria for moving to level 1 would be ensuring there's no community transmission. Can you sort of detail exactly what it means to have no community transmission and what criteria there are around that?
Well, at the moment we're in a position where there is no community transmission. What we want to see is that is still the case once we settle into the full Alert Level 2 arrangements with, as has been signalled previously, with that size of that top end size of gatherings being at 100 people, and we would want to be sure that we were still seeing no community transmission. That is, that we're not seeing cases that we cannot link back to international travel or to other existing cases that we already know about.
Was that April 1, the last time there was any case that you couldn't link to international travel? Or to
2nd of April was the last time we had a case that we couldn't link directly to a case, or where it wasn't very clear where the person had got their infection from.
The level of coronavirus is going to be 18 under 5s to contract the virus. On the website it says overseas, linked to overseas. Does that mean that it was mostly their parents, or were there any cases where it was an ECE centre where someone was linked to overseas?
Well, I can't speak to all the earlier ones, but we didn't. My strong recollection is that there were no cases that affected an early childhood education centre right through our outbreak and through the alert levels. That would imply that either they had travelled, our cases in under 5s and indeed under 10s had, under 5s had either caught the infection through having been overseas and coming back, or through transmission inside the family home. And that was the case in this case that we announced yesterday.
Message to parents sending their kids off to school this morning. Some are feeling quite nervous. What's your message to them?
Oh, I can understand why people might be nervous, and I think some people are nervous coming back to work and riding public transport and something. And my message is the same to everybody. The work we have put in over the last 7 weeks, particularly through the lockdown, and then our stepped and managed approach to come out of the lockdown, has put us in the best possible position, and we can have a high degree of confidence that there are not cases of COVID-19 out there that are creating a risk either for school students or indeed for others.
Not to send their kids to school today, what would you like to say to them?
Well, I hope that they will be reassured as well over coming days that the risk is very, very low, if there at all, and that schools have done an enormous amount to ensure that they are keeping students and staff safe in the school environment.
A child who tested positive yesterday and was linked to the Rosewood cluster, a household contact of a healthcare worker?
Yes, that's correct.
Were there any sort of mistakes that healthcare worker made that meant that passed on to the home?
Well, I can't comment on that, but I don't think anyone would have made mistakes. What we've seen in our outbreaks here in New Zealand, and it's the same pattern elsewhere, is that the family home is the place where transmission most commonly occurs. And one of the things we're looking at the moment, of course, we don't have any new cases in the community, but we're looking at how, at the range of options we can offer families to help reduce the likelihood of transmission inside the family home. And that might include making available other accommodation options for that family member who's the case to greatly reduce the risk of any further transmission inside the family. Perhaps the last question up the back.
The cabinet documents that were released a couple of weeks ago show sort of a picture of a lot of frenetic activity around the period, the development of the alert levels and going into lockdown. But on Friday, March 20, the day before the alert levels were announced, it was thought that we would be in alert level 2 for 30 days. What changed in your thinking and the government's thinking to push us just a couple of days later into lockdown?
What changed was, what changed was not only could we see the pattern that was happening in New Zealand, but it was very clear from what was happening overseas over that weekend we could see that we would be on the same trajectory. That was the first thing. And the second thing was that the countries that had wide outbreaks had to put in place very strict lockdowns to be able to get on top of it anyway. And our view, we developed a view very quickly that ideally we would go into an alert level 3 or 4 posture very quickly to not only avoid a further increase in cases at that exponential rate, but also to protect our healthcare system, and with the intention of being able to stay in lockdown for as short as possible to be able to get the economy going again. And that became very obvious to us as we looked at the experience of other countries, particularly those in Europe.
And one last question for the Commissioner, if I may. We've seen a lot of attempted sabotage of mobile network infrastructure and cell towers. What are police doing to sort of cope with this problem?
Obviously, we will investigate very thoroughly when this is going on, and we suspect that there's potential some of these events are linked. This is critical infrastructure, and it's reckless, to say the least, to try and damage it in this way, so we will be dealing with it very firmly when we identify those responsible. Look, I think critical infrastructure always has the potential to be, but whether it is in a particular case depends on who's reliant on it.
Thank you very much.
Thanks. There have been a few communities which have expressed continued need for community roadblocks. At level 2, are police changing their approach from working with these communities, or is it sort of now looking to remove them?
We've been clear that we don't think they're required in level 2, and communities have agreed with us in terms of that. There are no checkpoints operating presently, and we don't see the need for them.
Thank you.